Hello and welcome to A Science Affair. I'm your host Ava.
And I'm your host, Taya. Tonight, we'll be diving into the world of genetic screening and neuromuscular diseases, or NMDs for short. We're accompanied here tonight by a lovely group of experts who are here to help us understand a greater depth about diagnosis. I'd like to introduce Dr. Stephen and Dr. Eric, who have dedicated themselves to the research of NMDs, and Dr. Sophie with Tiana, who have had their first-hand experience with muscular dystrophy.
Welcome guys, and thank you for giving us the time on your Friday night. Hope you're not missing out on dinner.
All right, so neuromuscular disease. It's a term for a range of conditions that affect the functioning of muscles and their direct nervous system control. These include muscular dystrophy, MG, and more. These disorders can cause your muscles to become weak and waste away.
Yeah, and affecting an estimated 300 million people worldwide, NMDs represent a significant health burden to society. The leading cause of disease is genetic, either being inherited from families or caused by spontaneous gene mutation. Although that's mostly the case, NMDs may also arise from viral infection, drugs, and/or poisons. Due to the rare and under-researched nature of this field, many NMD patients endure a delayed and incorrect diagnosis. Currently, the diagnostic process takes on average 6 years, requiring countless appointments with specialists, many medical investigations, including invasive biopsies and genetic screening. Because of this, it's really important that effective and efficient diagnostic approaches are available to expedite the conclusive diagnosis and begin the treatment.
Wow, I just can't imagine spending 6 years not knowing what's going on with my own body. But it's interesting you bring up genetic screening.
Yeah, what types of genetic screening do we currently use?
The most well-known type of genetic screening that is currently used is known as Sanger sequencing. In really simple terms, it determines the sequence of nucleotides in the DNA. This method is typically used when we're trying to determine the sequence of a small fragment of DNA, but an up-and-coming type of genetic screening that's currently being talked about is whole genome sequencing. That is where the complete DNA sequence of an organism's genome is analyzed. But why is it in question?
Well, thankfully, Dr. Stephen and Dr. Eric, two renowned clinical geneticists, have joined us today to discuss this technique. Hey guys, thank you for your time. So, Dr. Stephen, why genetic screening?
Yes, well, firstly, thank you, Ava, for having me. I really do believe that whole genome sequencing should be used as a standard clinical practice for the screening of rare neuromuscular diseases. The diagnosis of neuromuscular diseases currently involves relevant history, family history, and clinical examination, and laboratory studies such as electromyography. Take congenital myopathy, for instance. When diagnosing this disease, the EMG results can either be normal or might show a mild specific change of myopathic character. This ambiguity can delay diagnosis, which is why now increasingly whole genome sequencing is being used to confirm the subtypes of this disease, as it reveals both large and small variants in the DNA that could be causative of the disease. This is also seen in myotonia congenita, where conventional diagnosis techniques such as clinical history and EMG results only direct towards a diagnosis, but genome sequencing allows for the confirmation of the disease. Similarly, invasive nerve and muscle biopsies nowadays rarely add useful information to a diagnosis, unless it is specific niche of conditions. Thus, such testing will allow for the definitive confirmation of a disease.
Well, do you agree, Dr. Eric?
Well, the problem with whole genome sequencing is that it's a strenuous process that requires multiple expertise to fill in the information gaps. It is great that we are coming up with more ways to diagnose existing neuromuscular diseases and identify new NMDs, but currently at this point in time, physicians are not trained to interpret the large amount of complex genomic data that whole genome sequencing produces. Evidently, the medical community has not introduced whole genomic sequencing in its daily routine diagnostics, as it is more expensive due to the fact that extra work is required. Currently, data suggests that cost estimates for a single test ranges from $1,906 to a whopping $24,810 for whole genome sequencing. The costs are more than 5 times that of whole exome sequencing, and whole genome sequencing is not typically covered by insurance companies. In addition to that, the method is more computationally demanding and requires more experimental work for full efficacy. Furthermore, this method could lead to more problems. These problems include potentially bringing up more unforeseen problems from processing the bioinformatics. This will cause patients to be more worried and potentially cause more mental strains, such as anxiety.
Yeah, that's true, Dr. Eric. High cost does question its practicality.
Yes, I understand it may be costly, but I think the diagnostic benefits definitely outweigh the financial cost. Whole genome sequencing should be allowed for the identification of new variants and genes of neuromuscular disorders, as they can identify from single nucleotide variations, insertions, deletions, to larger structural variations. This can expand the available information of a disease further, improving the diagnosis of the disease in the future. Furthermore, complete whole genome sequencing would be beneficial to determine appropriate intervention methods. Through more efficient identification of the underlying genetic abnormalities in neuromuscular conditions, potential genetic-based therapeutic agents, for example, eteplirsen for Duchenne muscular dystrophy, can be administered to the patient more efficiently at an earlier stage, rather than when the condition is clinically observable. This will provide the patient with more comfort at an earlier stage.
The panel discussion is definitely getting heated tonight. Dr. Eric, any thoughts?
I do agree to some extent, but evidence currently shows that its success rate on identifying new strain is not as good as we think. As explained in Foley A's paper, while whole genome reference data have since improved to better flag potentially harmful variants, such as in collagen 6 alpha-1 gene, whole genome sequencing and interpretation will likely remain blind to some variants that targeted methods like next-generation sequencing and Sanger sequencing identify more reliably. This could stem from the fact that there is an incoherence of coverage, an inadequacy of alignment, limitless variance, and as well as false interpretation due to inaccuracy of predictive algorithms and patchiness of comparative data from healthy controls.
Yes, it looks like there's going to be an ongoing debate. Like with all methods, it sounds like it can prove to have great potential, but it needs to be further researched for efficiency and cost reduction.
I definitely agree. Now, before the start of the show, we put up a live Twitter poll. Do you think whole genome sequencing should be used as a standard clinical practice? Haya, what did the results look like?
Okay, so 73% say yes and 27% say no. Interesting. The poll will be up for the rest of the show, so head on to our Twitter at ScienceAffair to vote. Now for our final segment, we wanted to bring you a first-hand story. We're currently joined by Tiana and Dr. Sophie, who have been working together towards treatment for her progressive NMD. Tiana, starting with you, how are you doing?
Hi, thank you for having me. Yes, I'm doing okay. For the longest time, I've been plagued with a rare type of neuromuscular disease that began when I was a teenager.
I'm so sorry to hear that. Dr. Sophie, what symptoms presented first?
The patient's condition suffered a particular kind of neuromuscular disease where there was a progressive proximal weakness, deep tendon reflexes, and muscle fiber necrosis and regeneration. This was indicative of an underlying dystrophy, and the family was told it was likely a form of autosomal dominant muscular dystrophy.
It has been terrible living with this condition. Because of the disease, which the doctors were unable to diagnose clearly at the time, I was unable to move normally. My overall quality of life has decreased significantly. However, I heard of an electronic data storage device which allowed us to annotate whole genome sequence data and predict our risk of some common diseases from a genome interpretation company.
Oh really? So Dr. Sophie, tell us about that.
Yes. So with the data obtained, the genome data, we were able to identify a heterozygous missense variant in collagen 6 alpha-1 gene as a possible candidate. However, this could not be the cause as it was in the general population. So we investigated other potential genes. We did further testing, including low extremity muscle MRI and having follow-up sequencing of the collagen 6 alpha-1, 2, and 3 gene. Even though the technology the patient used did not give us a final diagnosis, it helped direct future diagnosis and arrive at Bethlehem myopathy.
Wow, I never knew such devices were available for patients. I might get one to play around with.
Yes, and after a long struggle with diagnosis for my Bethlehem myopathy, I became desperate in finding my answer and had heard about these technologies. Although the diagnosis was not necessarily the correct gene being identified, it gave me a sense of agency and control over something I would have thought I would have little control over.
Yes, the results Tiana gave were surprising. The device you brought in had its own annotated whole genome sequence, and we were able to identify Bethlehem myopathy as it helped us flag the collagen 6 alpha-3 variant, which was previously overlooked. As a result, with the diagnosis, which helped the patient by providing counsel to the family on its autosomal dominant inheritance pattern and risk of occurrence.
What a wonderful success story. We hope treatment goes well for you, Tiana.
Well, that brings us to the end of the show. Let's close off the night by looking back at our Twitter poll. So Ava, how are the results shaping up?
Wow, 91% said yes and 9% said no. Seems like more people would like whole genome sequencing. Let us know your thoughts on Twitter using the hashtag WGSAScienceAffair. Well, so that's all the time we have tonight. Thank you for joining us, and another big thank you to our special guests.
This is a Science Affair.
Good night.
Good night.